Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is. And we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
Good morning. Good morning.
Yay.
Back again.
Another Sunday, another Chiefs Sunday.
Yeah.
I know.
What time do they play?
I think noon.
Oh, at noon. Oh,
Yeah, I
okay.
think so today. Mm-hmm.
Okay. All right. Well, then we should get a roll. We should get moving.
We do a lot of talking beforehand, but it's we have to catch up. We have to catch up. We both are very busy. We got a lot of stuff going on during the week, a lot of little things editing the podcast and little things we got to do, and plus our other lives. So we don't usually chit chat during the week unless something
it's all business during the week.
All business, right?
So this is our catch up time.
Yeah.
So in our conversation last week or the week before, I think the week before, we were talking about, it came up that we're entering into suicide season. That's a, made up term. I don't think anybody, I think it seems like we would talk about suicide season in the ICU because we experienced so many times over the years when people would, it's just an obvious fact that people kill themselves more between Thanksgiving and New Year's than any other time of the year. And so we want to talk about it, and we're going to push this out sometime sooner than later, just to make people aware of this time and what happens. And, maybe we, in our conversation today, we can find a little bit deeper understanding of why. I mean, I think we know why.
And I think, we're not really gonna, there's a lot of information on suicide, and, so this episode will be prefaced that it is suicide. And, for some, it's not very easy to talk about, especially if you've had it happen to someone very close to you, or you possibly have even attempted yourself. And it's definitely not anything that we want to make light of or that we can solve for you. But I think, our focus mostly today is going to be on nurses and some of our stories and dealing with patients that come into the hospital and that you are around. I think we talked about it in Riz's episode that just the energy of that situation when the patient comes in, even just starting in the ER. If you've got lights and sirens bringing a patient in who's unresponsive and they're either bagging the patient or maybe they've already intubated them because they overdosed on something or however it happened. That energy is high, and it's quick and it's moving, and you do not have all the pieces. You just have this person in front of you that you have to manage, and you're saving their life or not. And so sometimes it stops there, sometimes it even stops in the field, but we get a lot of them. We the hospital, the healthcare system gets a lot of patients, probably more so during this time of the year, that are either contemplating suicide, have attempted suicide, or succeeded at taking their own life.
I hate
And
the word I hate the word succeeded. What about,
okay,
maybe, chose an effective method?
right.
I just
Well,
hate
but
that it's
sometimes,
succeed.
well, I don't know, because sometimes you can have the you can use 2 people can use the same method and one goes and one doesn't.
True. That's true.
So it's not succeeded is not the right word. It's not a success. And I don't even know what that is. But more
Mhm.
so focusing on the energy that a situation like that brings in and how it affects the nurse is really, so we don't want to dismiss anything. We don't want to have people think that we're making light of, or that we didn't bring this particular aspect up, but our focus, is going to be more
Just
on
on
the
our
energy,
experience.
our experience. Yeah. And,
Yeah.
and we're nurses, and we've dealt with a lot of people who have tried to take their own life,
Mhm.
and some of them have and some of them have not.
Yeah.
And there is all kinds in between of the ramifications of their actions, and
Mhm.
that just, it just, like a ripple, like you drop a stone in a lake and it just ripples out, and it affects them, it affects their family, their children, the caretakers on scene, the people at the hospital, the doctors, the police officers, everyone involved in that. It ripples out and touches and affects, and that ripple, all of that is energy. And nurses, I feel like, take on a lot of energy from situations like that.
I think I've said it before that the one of the biggest indicators for a suicide attempt is having seen someone else do it. So that kind of informs informs the number of suicides that are happening within the nursing culture.
Yeah.
It's part of it, I think.
Yeah, and the images, some of them never go away. I remember my first one, I wasn't even a nurse, I was a tech in the ICU, and it was a young kid and who had shot himself in the head, and he was still alive, and he was on the ventilator, unresponsive, obviously, but it was more in the back of his head, like it didn't, so it went in, but, and I don't know the gist, because again, I wasn't a nurse then, but I remember bathing him because it was nighttime, and turning him over, and we had chucks underneath his head because there were brain matter coming out of his ears and coming out of the back of his head. And when we turned him, his head, the feeling of his head, like, I'll never forget it. It wasn't solid. It was swollen and squishy, and
Mm.
he did not survive. But the drama, and I don't mean drama in a bad word, I mean drama meaning increased energy and emotions and things that come with something like that when that happens. The story, the why, the mom, the letters, the where did he get the weapon, all of that stuff. And as an intensive care unit nurse, you're there dealing with that and being around it for 12 hours or more.
Mm. You're all the way in it.
Yes.
Not just in the caregiving of the patient and making sure that they're stable and receiving the best care, but you're also managing all of the emotions of mom and family. You're asking all of the questions to you're it's like you're the one that is piecing together the puzzle to
Yes.
understand what happened. So you're an investigator, you're playing all of these roles and as that as that person who's I mean, it's just such a dynamic role that we play in those situations. It's really remarkable.
Yeah, because it's not just like, case management might come in and try to, like, get phone numbers, and, you know, because there's a limit to what the bedside nurse can take the time to do, because obviously their priority is the patient and the clinical
Mhm.
care. Um, but, it happens on a Friday night. There's nobody there till Monday. So
Uh-huh.
and the police might be calling. You have to have some information. The doctor wants to know, like, you're expected to kind of know and have some kind of story. That was
Mhm.
always something that I, and still to this day, like the ICU nurse, whenever we report, it's a story. You kind
Mhm.
of create,
You're
like,
telling a story.
yeah,
Absolutely.
even if the patient had been there for 5 days, you've got, we used to call them, remember the old days, we called them a Cardex? Remember that?
The
It
like
was like, it
the
was before,
report sheet?
kind of. It was, like a heavier weighted paper, and it had all like you would write kind of a summary of the shift
Mhm.
and what happened, and it would just log the thing. So just like patient notes now that are in the computer, but this was a visual log so that you would just pull out the Cardex and you would see kind of like a CSR, which I haven't
Mhm.
said that in a long time.
You're
What
right.
does that even stand for? What does that stand
I
for?
don't
I don't know. Anyway, it's something you print off that has a summary of the patient, when they
Charting
came in,
systems
all their
assessment
doctors.
report?
Maybe. That sounds
Charting
good.
systems assessment report?
Maybe. Yeah.
Maybe.
But you have to have every patient has a story, and nurses get good at storytelling. They get good at coming up quickly. Over your years, you just develop, the story. Da da da, came in, da da da, had that. Doctor came in, we tried this, that didn't work, that killed her kidneys, then we did this, she went on bypass, blah, blah, blah. Like that's the story. But
Yeah.
a lot of times with the intentional and even unintentional, overdose or suicide attempts, the story was much more dramatic. It was much less clinical and more, case management ish.
Well, I mean, so kind of bring it back to suicide season, like so why are these people choosing this time? I mean, the obvious things are, broken family systems, not, the absence of family systems, meaning you're aging, and maybe your family's died, and you're the only one left, and you're left with all the sadness and grief of having to go through this season of time without the joy and connection of family that you used to have. Those are some very obvious ones. Finances. I remember in 2000, like 2008, 2009, 2010, maybe even 11, that financial crash took a lot of lives.
Mhm,
I remember so many people, especially in the holiday season, when money gets tight because you buy gifts and
mhm.
everything, taxes are coming due and all the things. And I remember some really professional people attempting to take their lives, and standing with them. And there's, like, as a caregiver, there's the obvious awareness of the shame that they're experiencing having
Mhm.
survived. There's very rarely a sense of joy. I don't know that I've ever experienced someone that was elated that they didn't uh
Oh, no,
that they
no,
survived. Um,
no.
but especially around the financial crash really uh, impacted a lot of people in that way. What else?
Well,
Um,
anybody with mental illness, whether it's anxiety, depression, and you're able to handle it for the majority of the year, summertime, you get long days, lots of light. You
yep.
get into after the fall back or the
Mhm.
whatever that is, it's dark. It's
It's
dark at
dark.
like 5 o'clock. And
Yep.
dark, if you just think of like light and dark, it is
Yeah.
dark. So you have a lot
Absolutely.
more darkness. So if you have darkness within, there's not a lot of light to filter
Yeah.
through all of that. And so you do see a higher instance of either increased depression, increased anxiety, increased, all of that. And it just becomes too hard to handle. It just becomes too
Well,
hard.
I think it's vitamin. Isn't it vitamin D that is a mood regulator that is activated by sunlight and the
Yes.
skin
Yeah.
specifically?
Yeah.
So the darkness is, prohibitive of that process taking place. So it makes perfect sense that we would get more
Right. And
depressed.
there's lots of things
Season.
you can do. You can get a sun lamp, you can do so there's lots of things to do, and people can just spit out those little things, but if you've ever suffered like real depression and you're
Mm,
very just baseline depressed, you can't make yourself do a lot of that stuff. And so it's a paralyzing feeling. It's a heavy, wet, weighted blanket on you. And so to think about, "Oh, let me get on Amazon and order, let me," even just scrolling to find the one you want, like, because you have nothing matters.
mm,
And it seems to be that that's the easiest thing to do for them is to just like eliminate. You've had suicidal thoughts. I've had
Sure.
suicidal thoughts. And it's it's a place that you just don't it's very hard to describe. And so not even being able to put words to something like that, and then they come into the hospital and now we're just presented with this situation, as nurses, because every nurse has bias too about probably even this topic,
Sure.
you know? I mean, you might have a nurse who lost a brother to suicide and she can completely understand the situation and is able to manage the family well and has a lot of connectedness to it and feelings that she's already processed through. Or you have someone who is suicide is so foreign and maybe they even have a religious or cultural bias about it and have like a thing about it, like
Mhm.
you're clearly not right. I don't have that, so I can't speak to that, but it's there. And so maybe that is something that's there to keep them at a distance from it. So
Yeah.
I don't know, because it's not universal. Every situation is different, just
Oh,
like every nurse
absolutely.
is different.
Absolutely. I mean, one thing that is coming up for me, like it takes practice. But for me, whenever I have, ruminating thoughts are so destructive. And whenever I find myself getting into the rut of rumination, I've just developed the practice of gratitude. That even when there was nothing more than I have a mattress that's soft and sheets that are clean. Thank you. Thank you that I
Yeah.
have sheets that are clean and a mattress that's soft and nothing else. Like in my mind, of course
Yeah.
there's a million other things that I am just unable to see at that moment.
Yeah.
And that's kind of the key to navigating this topic in this season, is that just because you can't see the good doesn't mean that it's not there. And if you will just be willing to say thank you for the smallest thing and let it grow from there, you'll get through to the other side. You'll and I mean, it's something that I've been practicing for so long now that I, even on the side of rumination, as soon as I start cultivating the gratitude, I become aware of all the other times that on the other side of that moment is really something great.
Right.
And so that I'm cultured to that process now, so that now all these years later, it's like I can get myself out of that rumination so fast now. And then there's faith that comes into that process, like
Mhm.
that. There's like the lived experience kind of facilitates the faith. It's kind of
Yeah,
a
yeah.
a, a dance. The more you trust in that process and in that dance, the more faith you have in it, and it's easier to navigate out of those deep dark places.
Yeah. Well, you're practicing pivoting the thoughts. So you're practicing refocusing what you're thinking about.
Hmm.
So you're thinking about things that make you feel ugh and like bleh, into focusing on things that make you like, oh, okay, you know,
Yeah,
because thoughts
they'll take they'll,
alone will take you
they'll take
down.
it down.
They will. And it's not even like I'm not talking about a thought that like an intuition, like a thought. I'm talking about like the thinking, what you
The
said, the
thinking.
rumination, the
Uh-huh.
ruminating, the thinking about the past, thinking about the future, what's going to happen, where have I been, and looming in that, and all of that. Just stop. You
Yeah.
have to
I mean,
stop.
that kind of brings up therapy for me. That I've done so much therapy, and it has been a tremendous value for me, a tremendous service. But there came a point where I recognized that what was happening in the office of the therapist was that we never shifted from the digging. We were always looking for the root cause, which is kind of like that goes into the objectivity thing and the enlightenment thinking that even psychoanalysis is a product of the enlightenment thinking, that we can figure out, if we can figure out the root cause. And to me, that's the dark side of therapy, is that if you never exit the deep thinking about why this happened, or what's at the bottom of this, what's underneath these thoughts and these actions and or whatever, if you never exit out of that, it's like you climb up this mountain, you figure out all these really deep and powerful things, and then if you never exit that and get to the other side of actually living again and outside of the office, it's like you're sliding down the mountain backwards. And it becomes unproductive. And that's definitely one of the dark sides of therapy. And like, I could see someone becoming suicidal or severely depressed after going through something like that. If they never exit, if they never get to the other side where they're actually creating the life that they want, it could be very destructive.
Yeah, that is so powerful. Creating the life that you want, that's the purpose. And so I too have done therapy for so many years, because in my world and in my knowing, that's all I knew. If you're having trouble and you feel a certain way, you go to therapy. You go to a therapist. And yes, there are lots of things that I've learned in therapy. There's lots of things that I've learned about myself in therapy, but there were a lot of just like lots of wasted time, in my opinion, ruminating about
Mhm.
what happened, your childhood, your what all the things. And I think it is good at some point in your life to kind of look back, to know where you've came from, to recognize some of those things were hard on you, because that is what has created you and what you're looking at externally now. But what really matters and what really makes a difference in our lives is the now, right
Mm,
now, creating what is now, um, looking for forward, but yet appreciating and living now. And I
mhm,
guess, when you're in those ruminating thoughts, sometimes thinking about the past gets you out of that for now, but for me, that didn't sustain anything. That was a
mhm,
moment thing, and it was really only when I started practicing living and being in mindfulness in the present moment of what here you are right now and how you feel now, then creates what I then see outside of my inner brain and my, with what's within me. And being exposed to all of the things that we were exposed to at the bedside, including suicide and
mm.
patients who ended up taking their own lives, and the aftermath of that loss with the family. So then we go back to talk about grieving again. It is just all grief.
Uh-huh.
And nurses, unless you know the skills, which I never did, you have to be able to release that. And not if you feel like you need to release. That's not what I'm talking about. I mean, practicing the active, taking the necessary actions to release, whether it's after your shift, whether it's during your shift, but especially after. If I could have had a ritual or a practice of releasing that energy, processing it through, I wouldn't have been holding on to so much.
I
And
mean,
all of that, it affected me.
yeah,
Yeah.
yeah. No, I mean, that's like that's kind of, the therapy is absolutely necessary, especially when you have carried the weight of all of the burdens of being a healthcare provider, that, knowing that a patient's dying before they know, and having to treat them, having to live with them through all of the phases of acceptance of their
Mhm.
impending death, and carrying that knowledge, carrying the burden of that knowledge, carrying the burden, like I said a few weeks ago, walking past the family members after you just broke every rib in Mima's chest, and you look at them in a conciliatory way or consolation, and the question, can they sense the violence that I just did on me? Like, is it and not knowing that, carrying that, all of the burdens that we carry. I mean, 20 years of all of that.
Mhm.
If you don't unpack that shit,
Yeah.
like, you have to. The therapy is not an option. You have to unpack that. I'm kind of getting lost with my words, but I remember. It. Do you still, like? Sometimes I don't know that even now, with everything that I know. I mean, I do have rituals and practices that I do daily that help me. But do I really know how to let go of the experiences that I'm having still? That's what was coming up for me when I was listening to you. Like, even now, all these years in, do I even really know how to let it go and process it out so that I'm just not carrying it? I don't think that I could honestly say that I fully am able to let go of everything.
Well, and I don't know if we ever can actually let it all go, but one thing I know that we both do is we have an awareness of just the fact that things do bother us and can
Mhm.
cling to us. Where
Mhm.
before, like the last couple years when I was, full-time in ICU, I never thought that. I never thought that thought. I never went into the work. I never went into work thinking, there's a lot. This is a lot. This is a lot, and there's a lot going on, and, some of this is gonna be hard, and it's heavy, and because I never had conversations like the ones that you and I have.
Mhm.
So, I wasn't processing things the way that I do now. Now, I am not in a high-paced ICU anymore, but I do some of my shifts in the ER when I work them have been very busy and up to the par of what I would say I would experience in ICU, even in a very small ER.
Sure.
Not often, because couldn't do that very often, but every now and then, over the last couple of years, I've had a shift, and I am different. I am more peaceful. I
Mhm.
am more calm. I am in more control of my emotions because I'm aware of them. I've done digging, I've evaluated them, I have allowed them to flow, I've acknowledged them, I've been learning about how and why all of this energy and how it just kept me down. It kept me
Mhm.
so tight and down. And so really, it's not work on the outside, it's work on the inside. And when you can feel peace and you can practice just being with yourself, whether it's meditating, sitting in nature, looking at the clouds, even reading sometimes, just being, I could never do that before. I was always
Mhm.
busy. I was always outside of my own mind. I was always doing this. I always had something going. I didn't really even like to be by myself. I didn't like to be where no one was. I literally when the kids were little, I can remember coming home if no one was here, like I had anxiety. And but now practicing all of that, you I just have a different outlook on things. And
Mhm.
so processing things, I suppose if you had like a really hard shift, we would know that like that was a lot. And I mean, sometimes I even do the like,
Yeah, 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 yeah.
wiping of the
Yes,
energy, like
yes.
get it out, get it out.
Yeah,
Sometimes
no.
too, I'll do a fake zip up. I zip my toes, I zip up all the way around, zipping
Uh-huh.
my bag. It's just like I don't want to get so deep in that.
Uh-huh.
And would we, knowing if you had a patient come in, just think of yourself now, who you are now, and you were in a unit and you had or an ER and you had a patient come in who needed all that stuff. Aren't you Isn't your approach different now than it used to be, say 5 years ago, 7 years ago?
Well, I mean, I actually wasn't practicing 7 years ago. It's hard to believe I've been back at the bedside for going on 5 years now, which is
Yeah.
just crazy.
Yeah.
But no, I mean, I'm just, a salty old dog, I guess. I don't get super excited. Like you remember all those old salty nurses that we
Yeah.
worked with, they never got excited.
Yeah. That's me.
Nothing
Yeah.
nothing excited them. I've kind of transformed into that person now. Like
Yeah.
it just water off a duck's back when things are going sideways. And, before you kind of matched the energy of it. And now,
Mhm.
like, I don't have to match the energy of it. I still am able to step up and perform. And it's just much calmer than it
Yeah.
was
You're
before.
you're above it. You're
A
in
little
it.
bit above it. Yeah.
Yeah. I mean, you're lighter and not so dense down here with this like heavy stuff that you don't even know that is stuff that's in there that's holding you down. Like you don't even know. I
Yeah.
didn't even know. I didn't
Right.
even know. I was so, in it. And you're right. Now is like this is a funny story. So I came home last night and my oldest daughter was having her Friendsgiving here
Oh,
in the
okay.
shop. Okay. And I come in and like everybody's here. She didn't talk to me at all about it. And they had one last year at her house and now they're going to have it out here because there was a few more people coming and the shop was bigger. So we didn't I mean, she asked if she could come over and do it. I said, "Yeah, that's fine. Great." Well, I come in and like my husband and my son had been cooking all day, all cooking all of this stuff for her. She's in here frantic, like trying to cook the peas and the corn and the microwave and there's shit in the oven and all this there's like other people shaking the gravy and trying to get it all. And I was like, what is going on? So it I was a crisis manager. Like, I came
Uh,
came in and I was like, "Oh, this is like a full Thanksgiving meal. Okay. Well, I mean, I've been doing that for 24 years. We've lived here and we've had Thanksgiving every year." So, you just go into that mode of like, "Do, do, do, I'm stirring the thing, we're getting
uh-huh.
that, I get the tinfoil out, I find the hot pads, she needs plates, she needs napkins, she needs silverware, get that, go in that." And I was just like, "Do, do, do." And even someone made a comment was like, "Oh my like, thank you." You came well, that's what we do. We manage crisis like that.
Uh-huh.
But it doesn't drain me anymore. I think that's the difference. But again,
I
I don't know what
still
gets you. I don't know.
I mean, I had a rough code a while back that really messed me up. I mean, it,
Yeah,
it got to me. I mean, again, I was super calm. I was super cool. I did all the things. I barked the
and I don't think
orders.
you
I
can
did
avoid that.
but
I
it
don't
was
think you can
very
avoid that.
upsetting. Yeah.
Yeah, yeah. But think about that situation and who you are now, and then think about a similar situation when you were back in the unit. Are there differences?
The energy level would have been so high through the whole thing, through the whole
Yeah.
thing, and maybe that's the difference is that the energy level was so high back then, and all the hormones that were just racing through the veins. Maybe they prevented me from being able to see the damage that was being done. Whereas
Mm.
today, with that level of calm, and of course, the hormones are still there, but because I've stayed calm, my mind is not racing to find the answers. It's just there and doing the things. Maybe that is why I'm able to see the effects on my soul and spirit more now. And just
Oh.
again, the process of introspection, like developing the muscle of introspection, I think
Yeah.
is also a factor in that.
Yeah,
Uh,
that really gave me an aha right there when you said that. So we are more in tune with our internal environment
uh-huh,
and our so when we are in situations like that, we can see it clearer
uh-huh.
now, but we
Yes.
can name it and label it and because we have an understanding about it. And the practices that we do or that one does to become mindful, like the breathing, the meditation, the practices that it takes to get to a place where you can do introspection and you can look within, because you can't just start doing that. It doesn't just
Uh-huh.
happen like, oh, just take a look within. No way. You know, it takes some time, and you have to be kind with yourself, and you might only be able to sit for 3 minutes, maybe only 2 minutes, and with a meditation, or you might only be able to do one round of breathing, because it's so, and we each have our own little things. And you've developed a in-depth breathing practice, which completely has you only on the inside, only
Mm.
looking, being within, because you are only focused on your breath. That's it. There's
Uh-huh.
no thinking. There
There's
is
no
no
thinking.
thinking. You can't. If there's
Yeah.
the breaths come too quick, the holding. When I do it with you, I think about, I don't, my mind doesn't wander. So it's interesting. It, and maybe that's practice too, because I don't do that Wim Hof breathing very often, but I do learned about breathing, and it's practicing. Notice it going through your mouth, notice it go out, notice your belly go big, notice your belly go. So it's just this practice of noticing and being, and not being judgmental when the thoughts go, and you just shoo them away. But and me with meditation. So being able to meditate, I mean, I can meditate for 2 hours.
Mm.
The longer I do it, the more the longer I am in that meditation, not how many times, but just during that, I'm like after like 30 minutes, 45 minutes, and I'm into like an hour, like I am like, it's like I'm high. It's like if I could literally stay there all day, every day, that would be wonderful.
Yeah.
But we can't. We have to come back down and we do this. But just the practices of going inward that have opened our eyes to see things differently on the outside.
Yeah.
Yeah.
Absolutely. So how does this how do we tie this all back into suicide season?
Well, I think that with, we can generalize everything that nurses have to deal with, but suicide to me is on a higher level of energy that comes in and surrounds something like that. Because you think about it, nurses will know. You think about the MI, the cardiac, heart attack that comes in.
Mhm.
And that's intense. You're running, you're doing, but a lot of times they survive. Most of the
Mhm.
time they do. Um, Especially if you get them in the cath lab, I mean, quick. Or you have an open heart who goes bad, and you kind of know what to do, but it's a lot clinical. There's something with suicide that brings in multiple other dimensions of energetics, as far as the family, the story, the how did they do it, and just the in general of someone being at such a low that the only option they feel is there is to just eliminate themselves. That is so heavy. You add
Yeah.
mental health and nursing, and then you just got a whole nother level of depth.
I'm just remembering my friend's very apt statement that suicide is the seduction of rest. I'm just remembering
Oh,
that idea. We've talked about it before. It's so sad that
mhm.
that's the only option.
Yeah.
That they're so many times just so worn out by the burdens of modernity, all the trappings of modern living, and our disconnectedness, and so many broken families. God,
Mhm.
so many broken
Yeah.
families today, my own included, um, and not knowing how to repair it. I mean, that's probably the hardest thing,
Mhm.
um, and maybe you can't, and that's okay too. It's just what it is,
Mhm.
you know, and then with the economy the way that it is, it feels a lot like 2008 to me, and I can imagine so many people are out there not able to buy gifts for their kids or their
Yeah.
family, or their mortgage is coming due, and they can't pay it, and the crisis that brings about.
Yeah. Well, and I practice it because I believe that the more you think about something, the more it brings in.
Sure.
And so, practicing thoughts of just what I feel like what I can do is send my thoughts using spirituality, sending my thoughts of love and even wealth to them, and putting it out there. I feel like the more people that are putting out goodness and kindness and compassion and love and, things that elevate the society, because there's nothing just like that you or I can do about it. I mean, just because it is,
No.
we have no
I mean,
really
this is
control
this
over
is this is what we're doing. We're having this conversation.
it. Right.
We're in your terms, putting the energetics out just by having this conversation and bringing awareness to the fact that more people kill themselves in this season than any other time of the year,
Yeah.
and talking about why and the impact of it. That you know, I guess one thing that I don't know that I've ever said on here before is that the thing that kept me from doing it was I had this woman in my life. It wasn't a romantic relationship or anything, but I met her and I recognized a very deep sadness, and I never addressed it, never asked about it. I just was always, every time I was around her, I recognized it. And about 6 months later, I discovered that her husband had killed himself. And the sadness that I saw in her, and all of the emotions that I was feeling her give off, were so heavy. I fully understood the weight of what I was feeling from her, and I decided I couldn't do that to my kids. That experience, in a lot of ways, saved me. I mean, I still almost lost my life, um, but I was not actively trying to do that.
Right.
It was
So is that
for
something
sure
you thought about?
accidental.
Is that something you thought about in that moment when you
Not
called
it.
911?
No, 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 no. That was in that moment. Again, I was addicted to Adderall, and um, I don't think I don't think I had slept for 3 days or more. So I didn't have a clear thought of anything
Okay.
in that moment.
So something deeper within you that was not in your awareness urged you to reach out to call 911. Because why didn't you just sit there?
Yeah, I don't know.
It's deep, it's in your subconscious.
Sure,
Something was there. There was a light there that urged you to call.
sure. I don't think. I mean, that's the thing, is that I don't think I wanted to die. I don't think we want to die. I don't think that you kill yourself because you want to die. Suicide is the seduction of rest. Like, it is offering you something that you can't achieve now.
Right.
There's a very permanent solution to a very temporary reality.
Right.
Um, and but I know that I didn't want to die. I wanted to be I think I wanted to be saved. I think I wanted
Mm.
somebody to rush in and save me from the storm I had created for myself.
Well, something did. Something within you did want to be saved.
Yeah, yeah, but I didn't know how to do it myself.
No, and
And
nor was it
and
even probably even conscious to you.
no, I mean, I had to, you know, I mean, in that sense, that, that moment was, it was that. I mean, I've always said that. I don't know if I've shared this on here before, but I've always said that, it's kind of my Lieutenant Dan moment. Like, the
Mm.
storm is all around, and he's on the shrimp boat, and they're lightning and storm. They haven't caught any shrimp. They've been out there for a long time. They're broke and they got nothing. And the storm comes and it shakes everything. And Lieutenant Dan, with no legs, crawls up the mast of the ship, and he's holding on with one hand and he's shaking his fist at God, screaming at him in the other hand.
Wow.
And the lightning is crashing all around him. And then the next morning, the boat is just overflowing with shrimp. They're millionaires. They're and then it cuts to the next scene where Forrest is, I think he's getting married, and Lieutenant Dan walks in and he's got new legs,
Yeah.
and you got new legs.
Yeah.
And so that dark night of the soul for Lieutenant Dan is what gave him new legs.
Yeah.
He had to go through the storm to get to the place where he could walk again. And in that way, I feel like all of that craziness that I had to go through gave me new legs.
Yeah.
So
Wow.
I love Lieutenant Dan and his story. And
I mean,
I
that's an
would say
amazing
that
story.
it is amazing. Like that's, I think, if we're going to speak to the audience, to anybody that's thinking about or has suicidal thoughts, the storm is good. The storm,
Yeah.
the storm the storm will give you new legs if you let it. Don't cut your journey or your story short.
Yeah.
Yeah.
Yeah. And just noticing that can alter your path, It's in the I don't know. You can't, because when you're at that depth of despair, you're not logically thinking. You're not logically consciously
No.
um doing all of that. It's not it. And
Yeah.
I don't I feel like it's fate or the universe or God that, and whatever your life is determined to be are the ones who live and the ones who don't. That is something that always am like, that's so crazy. Like, I mean, there's stories that you're like, she lived? Like,
Yeah.
what? I mean, are you kidding me? And then there's ones that like took a few Tylenol and they died.
Yeah.
So, and you could say that about anything, about any condition that we've seen in the hospital, a heart attack, a AAA, or, emergent, or they come in, they have a toenail that gets infected and they get gangrene and they're dead, you
And
know?
they're dead. Yeah, yeah,
Yeah.
yeah.
So it's just another type of that. And so I guess to pull out from that is it is part of your journey. It's part of your story. And it's part of what you're here to go through to
Mhm.
learn about yourself, to another opportunity to go within and see who and what you're really made of.
Yep,
I'm
yep.
gonna get you a hat that says Lieutenant Dan.
Lieutenant Dan. Oh, that's great.
Yeah.
That's
I mean,
funny.
that story's book worthy, honestly. You're writing a
The
book. Aren't you
lieutenant
writing a book? Well, you're writing kind of a
I don't know
manuscript.
what I'm writing. I don't
You're
know if it's a
writing,
book.
yeah.
I'm
Yeah.
writing. Yeah.
Yeah.
I it probably is someday. I'm growing new legs
Yeah,
in
yeah.
writing. Yeah.
Yeah, yeah, yeah. I've
I'm
not been
figuring it
much
out.
of a journaler, mostly because I think out of fear of what will come out of the brain. But I've just been
Mm,
pushing myself a little bit more and more and becoming comfortable with what comes out, and it's really not even what I thought. So, we hold ourselves back so much because of fear, you know?
mhm. Yeah.
And fear really isn't even anything. It's just something you're making up in your head that
So
you're
many times.
scared. So
So
many
many
times,
times.
so many
It's
times.
crazy.
I know.
It's crazy.
Well, I think just with it being, the holiday season, and I'm sure lots of people will experience over the next several months things happening to people they know or people that they don't know or someone else and it could be close. It to just be aware of your own feelings and getting help however that looks for you.
Mhm.
If you need a therapist, if that's what comes to your mind and you need then go. If you
Yeah,
need to
just
call and
get
talk to
help.
a friend, then call. If you need to journal, if you feel like you need medication, I mean, I was on medication, antidepressants for I literally just got off of them in the last year and a half, and I probably started when I was 20, so at least 25 years.
Wow. It's amazing.
And
How do you feel?
I feel good. I had attempted it multiple times to wean off, and then I don't know, it was almost like a whoopee, like, "Ooh, I'm feeling too much. I need to ooh, I'm crying a little
Uh-huh.
bit. Oh, this okay, okay, I don't wanna go crazy here. I better get
Yeah.
back on 'em." So I did that probably 3 different times in the last probably 3 years.
Wow.
But this last time, and I've been adding in other modalities. You can't just like be
Sure.
like, I'm not doing that anymore. And I'm staying just the way it is. Not like that. It is a trade. And it doesn't seem like an equal trade, because taking a pill every morning is very easy to maintain this.
Uh-huh.
Doing meditation, taking time for myself, being aware of what makes me happy, what brings me joy, what doesn't, learning from that, moving towards happiness, moving away from things that don't treat me good. It's a lot of work, but I feel so grounded and stable now. It's stableness.
Yeah, yeah,
It's
yeah, yeah.
not just like a hit or miss. It's not just like the 20 minutes after I drank, my first glass of wine and then finish off the rest of the bottle. It's not artificial. It's real. And
Mhm.
I did it. I created it with help, you know,
Uh-huh.
from God, but mostly myself, because I'm the one choosing and doing the action. And
Mm.
it has given me a lot more trust in myself, that I am who people, I think, have thought that I was. You
Mhm.
know, I have characteristics of being a leader, but it showed on the outside, because that was kind of a persona that I was able to like get into when I was at work, but I was not a
But
leader
you
of
were
my
really good at it.
I know, I know.
I
And
I I I'll never not view you as a leader.
well, and I think I
Never.
am, but
Mhm.
I was not the leader of my internal life. I was being led by something, by forces.
Sure.
And I've gotten out of the passenger seat, and I've gotten into the driver's seat for my life and my emotional life and my thought life. Whereas before I was just a passenger, and I was just like, and that's why I had to get back on the meds several times, because I was just letting it.
Uh-huh.
But now I don't. I'm driving. Thank you very much.
Right, 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 right.
Sometimes I was in the fucking way in the back in the station wagon in them backward seats, no seat belt. But
You
now
you just throw that little F-bomb in there just so it's just so pointed and perfectly timed. It's just so
and I'll
great. I
never
love
stop
it.
saying that some of the smartest people are the biggest cussers. I'll never stop saying it. The most
Yeah,
intelligent people cuss.
yeah, that's too funny.
I know.
Well, we're at an hour.
Yeah.
I think we said some good things. I think
Yeah. No,
people
I
could
I think this was, a good time to do it, a good time to talk about it, because I think it's just gonna be something that people are dealing with more
yeah,
during this season.
yeah,
Yeah,
sadly.
yeah.
Um,
And so, if anybody has
hopefully
any comments or anything like
yeah,
that, please let us know.
yeah,
Like this video, podcast, share it with anybody that you think might need to hear it. Lots and lots and lots of nurses and healthcare providers are going to be dealing with these situations
yep,
a lot. And
yep.
if you know somebody who might benefit from just hearing us talk about it, because nobody talks about it at work. You're not like, well, what do you think
We
about it?
did a little. I mean, nurses.
Emotionally though, like
I don't
nursing
know.
wise, yeah. And I wasn't always super compassionate about it. I'll be honest.
Yeah, yeah, no, for sure. Yeah,
And I think some of that is that dark humor that we've talked about before, that is necessary to kind of get us through really, really bad situations like that. We're not unprofessional with it, but it comes out. Um, but just so that people and healthcare workers know that they're not alone, and that what they're experiencing um, is heavy, and can just be validating for those.
mhm, sure.
Yeah.
Yeah.
Well, maybe we'll have a lighter topic next week, or do we have a guest?
I don't know that we have anything scheduled yet,
We'll have to figure it out.
but I think, because we're gonna bump this one up so that
Oh,
it
yeah.
comes
Oh,
out.
so then we'll have Renee afterwards. Yeah.
Yeah, yeah.
Yeah.
So,
Yeah. We just get
alright.
it all figured out.
Alright, have a good
All
week.
right. We'll see you next week.
Bye-bye.
Bye.
We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below, or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.